My name is Sandra Martinez. I'm the Director of Public Policy at the California Wellness Foundation, and on behalf of the staff, the board of the foundation, I want to welcome you to this morning's briefing on the 2013 TCWF Field Health Policy Survey. We are very excited to share the results, so I'm not going to take up too much time. It's the 7th year that the foundation has funded the field poll, and I will tell you, and you will see, that the data are rich, tangible, and timely. People are talking about health in different ways and in different places, and the foundation is here today because we continue to work towards ensuring good health care for the people of the state, and we believe funding the field poll can help shed light on what needs to be done to improve health in California. This is a pivotal year for healthcare in this country, and all eyes are on California to see whether this monumental change in healthcare succeeds or fails. And we are banking on success, and we hope everybody here is as well. Thank you again for taking the time to be here with us today, and without further delay, I'd like to introduce Mark DiCamillo, the Senior Vice President of the Field Research Corporation and the Director of the Field Poll, who will present the findings.
Thanks, Sandra, and welcome everybody. I'm very glad that we have our distinguished panel of discussants here. I would just like to briefly tell you who they are if you don't know them all yourself. We have Diana Dooley, who's the head of the California Health and Human Services Agency as CHS's secretary. She also chairs Covered California, the Health Exchange, and serves on a number of other state boards and commissions that obviously relate to health and health policy. We also have David Tange, Director of Government Relations of Covered California at the Health Exchange. He works to ensure that the exchange's perspectives are reflected in state and federal policy regulations and in all legislative proposals that are put forward by the exchange. We also have Ellen Wu. She has served as Executive Director of the California Pan-Ethnic Health Network for more than 10 years. She also serves on the Managed Risk Insurance Board and is a board member of the California Budget Project. And finally, we have Dan Weintraub, who has agreed to serve in Bert Margolin's role to lead our discussion at the end of my presentation. Dan is the editor and director of healthycal.org. I'm sure you're familiar with his writings. He tracks major developments in health policy in California and has covered California politics in the state capitol for over 20 years. Has been a reporter for the LA Times, Sacramento Bee, New York Times. I mean, he served pretty much on all the major newspapers. Also, you know, and Mark DiCamillo, I've been at the field poll all of my professional career. I've been at the field poll since 1978 when Mervyn Field hired me right out of grad school. And I've been polling California for 35 years. I think I know a little about the state. I'm very excited about the data, and I'm looking forward to presenting it to you today. Now, if you do have questions of me, I think the way that's best handled while I'm giving my presentation, jot down your questions. You should have these just little cards. We'll be collecting them during the presentation. So as I'm going through data that is of interest to you, that raises questions, write them down. We'll collect them all, and we'll try to get to the cards in kind of clustered way by topic at the end of our panel discussion. Also, I think there is an evaluation form in your packet. We'd appreciate it if you would complete that before you leave today. And I think that's pretty much all of the administrative details. And I think for me, the best thing for me would be to just stand and present the data. There's a lot here. It's being released to the news media, if you've noticed, in 3 different waves. Today's story, in the B anyways, covered the just general attitudes on the Affordable Care Act. Tomorrow's story in the B and in other papers will be about the implementation of the Affordable Care Act in California, views about Covered California and various population groups as they relate to the target audience of Covered California. Okay, the affordable, this year's survey, as Sandra says, is the 7th annual iteration of the field poll surveys for the Wellness Foundation on health policy reform. It dates back to 2007 when Arnold Schwarzenegger first proposed major reforms to the state's health care system. And then that morphed into the actual Affordable Care Act when it was implemented in 2010. This year's survey is especially relevant and newsworthy as it comes just months before Covered California's website rollout and before the exchange actually becomes available to the population in January. Because many of the results of this year's survey, in my view, they should be viewed as kind of a pre-outreach measurement, especially those that relate to Covered California. Covered California has a massive job ahead of itself to outreach to the public, to communicate to people eligible for benefits under the Affordable Care Act. This survey was done in the summer, June and July, before that outreach actually takes place. So obviously it'll be very interesting next year, and hopefully the Wellness Foundation will get us back to do another survey, but to see how the needle moves over the next year, to see how the communications campaign actually has affected the population. Okay, so let me share with you first a little about the survey. There we go. You should have a document in front of you. If you can't see this, it's a little small, but everything that I'm presenting should be there in your packet. The survey was done among registered voters, so obviously keep that in mind, especially as you're looking at the people eligible for benefits under the Affordable Care Act. Registered voters are 17 to 18 million of the state's residents, but it's not all adults who are eligible. We did 1,687 interviews. This included a random sample of about 1,200 registered voters, and because one of the objectives of the poll was to give a bigger examination of the state's ethnic populations, we oversampled the overall population with another 488 interviews, just targeting Asian Americans and African Americans to bring those sample sizes up so that we could look at their results separately. We had obviously enough Latino Americans in the sample to just look at without any oversample. The survey was done June 26th through July 21. We included both cell and landline interviews. A lot of cell phone interviews these days. That's the only way to get through to many of the state's voters, and more than half of the interviews actually were conducted on a cell phone. The language of administration were 7 languages: English, Spanish, Cantonese Mandarin, Tagalog, Korean, and Vietnamese. Out of the 1,687 interviews, 1,298 were in English and 389 in Spanish, and the samples overall sample has a sampling error of about 2.5 points. Okay, the first slide just summarizes Californians' view of the Affordable Care Act. You can see that 53% of Californians are supportive, 38% are opposed, and you can also see that since the Affordable Care Act was passed in 2010, there has been no movement, pretty much as stable as you can get in terms of a poll, in terms of support and opposition. 53% to 38% is pretty much the average of every measure we've done over the past 4 years. However, the stability in the overall results masks big differences across different subgroups in the population in terms of attitudes about the Affordable Care Act. There's large support for the act in the big metropolitan areas. Los Angeles County, about a quarter of the state's voters supporting it, more than 2 to 1. The San Francisco Bay Area, also greater than 2 to 1. You can see the support is on the right, opposition is going to be on the left throughout these tables. However, in each of the other major regions of the state, slightly more voters are opposed than supporters. So once you get outside of the metro areas, there are actually more opponents than supporters. There's a big difference by coastal and inland counties. Probably the biggest differences relate to partisanship and political ideology. Democrats overwhelmingly in support of the law. This has not changed since the law's passage. Republicans overwhelming in their opposition to the law. This again has not changed since its passage. Here in California, the independents, or as we call them, the no party preference voters, are quite supportive. 54% to 37%. They look a lot like the overall population in terms of how they view the Affordable Care Act. Big differences between strong conservatives and strong liberals. As I said, the sample included large numbers of Asian American interviews, so we can actually look at the different Asian populations, compare them to the overall population and to the white, non-Hispanic, and Latino and African Americans. And one thing that is a major difference and probably separates public opinion in California compared to that of the nation is the big difference in attitudes and opinions of ethnic voters in California. Their overwhelming support for the law here is one of the main reasons why California is so much different in its perspective of the Affordable Care Act than the national public. Here, in white non-Hispanics actually are slightly opposed, 49 to 44, but Latinos, 66% support, African Americans, 82%, and as you can see, the Asian American populations are very supportive, ranging from 58 to 76% support. There are some differences by age. The youngest segment, which happens also to be a more ethnic segment in California, is more supportive, and the least supportive by age are the older voters, who are about evenly divided. We asked people how much they said they knew about the law. And again, this is a self-reported answer. It's not necessarily reality. In the current poll, 15% of the voting public said they were very knowledgeable of the law. That's not a lot different than what we saw 2 years ago. So not a big change. It was 11% in 2011. Most of the public says somewhat knowledgeable. So they've kind of paid attention, but they don't particularly think they're experts. We also asked the public what they think about the Affordable Care Act and its impact that it's going to have on the healthcare system. And 3 of the statements that we read were clearly objectives that proponents of the law want to see enacted, and we asked voters, how likely do you think each of these are come to pass? And most voters here are optimistic that the Affordable Care Act will do each of these 3 things. The first is most uninsured people who need insurance will receive government tax credits or subsidies to help them pay for it. The second, consumers will get greater protections and won't lose or be denied coverage if they have a serious health condition. And the third, the number of residents who are uninsured will be significantly reduced. 66 to 70% of all Californians think all 3 of those goals are likely to occur because of the law. 2 potentially negative effects that detractors of the law oftentimes say, and we asked voters, how likely do you think each of these are? One is seniors enrolled in traditional Medicare will see their health benefits reduced. Most observers think this will not happen. However, voters, 57%, think that that will happen. And in fact, when you look at the people who say they're very knowledgeable of the law, they're no different. So there is some confusion about the law. People who currently have coverage will be forced to change their health plans or their doctors, even if they don't want to. Now, this might occur among really small segments of the public. It's not that it may not occur at all, but most observers also tend to agree that this is not really going to happen for the large majority of people. Yet, voters, 54%, think it's likely to happen, and even those who say they're very knowledgeable of the law think it's likely to happen. So there is a lot of work to do in terms of what the public's view of the law is and its impact on the system. Okay, we asked voters, well, what will the law mean to you and your family? This has kind of held stable every year we've measured it. In the current measure, 23% say they'll be better off, 26% say they and their families will be worse off, and the biggest proportion say not much difference. Actually, if you look at the national results on this, let's say from Kaiser Family Foundation, in the nation itself, twice as many people think they'll be worse off as better off. So even though we're showing an even distribution of positive to negative, that's a much higher or a better ratio than what you're seeing nationwide. Many more Americans fear they're going to be worse off. Okay, what about the ACA's requirement that large employers provide health coverage to all their full-time employees? This is strongly embraced. Now, this is something that the Obama administration has delayed enacting until 2014, but even so, Californians are very supportive of that requirement. Democrats almost universally support it. Republicans about evenly divided, but nonpartisans also extremely high in their support for that. What about the Californians' views of the Affordable Care Act's provisions expanding the Medi-Cal health insurance program to cover more low-income adults? That is also embraced by a greater than 2-to-1 margin among California voters. Here, though, you can see some partisan differences on the expansion of Medi-Cal. Democrats strongly supportive, but Republicans are opposed. No party preference voters, however, are joining Democrats in their support. How important do voters think the Medi-Cal program is to themselves and their families? We've asked this question once before in 2011. This year we find 58% of California voters saying that Medi-Cal is important to themselves and their families. So it's slightly greater than it was 2 years ago. It's an interesting result. If you look at those 58% who say it's important to themselves and their families, who are these people? Well, as you might expect, the people who are insured through Medi-Cal almost universally think that Medi-Cal is an important program. But you can also see the strong relationship between the importance of Medi-Cal and income. Those under 139% of the federal poverty level, which is the eligibility for Medi-Cal, they're strongly supportive. It gets a little less, or strongly saying that it's important, less important to those with higher incomes. What about the perceived success of the Medi-Cal program in meeting its objectives? This is an interesting question because 64% of voters, both in 2011 and in the current survey, say that the Medi-Cal program actually has been quite successful in meeting its goals. And when you look behind the numbers statewide, it's interesting to me that even a majority of Republicans will concede, even though they don't want to expand Medi-Cal, they say that Medi-Cal pretty much is successful in meeting its objectives. So when we're implementing the Affordable Care Act here in California, who do voters trust more to make the implementation happen? Well, it's clearly the state government over the feds, about 2-to-1. 50% say state government, 27% say the feds. It's interesting in this survey, in this question, we didn't read the category neither, but 15% just blurt out neither. So there is a segment of the voting public that is cynical of government of all levels, especially Republicans. 28% say neither. They don't want to touch it. Okay, voter opinions of how successful California will be in implementing the Affordable Care Act. These are some of the results that you're going to be reading about in tomorrow's paper, and from here on, you'll see a lot of those. Most Californians are quite optimistic that the state will be successful in its implementation of the Affordable Care Act. 18% think very successful and 48% somewhat successful. So in all, it's about 2 out of 3, and that hasn't changed much since 2011 when we last asked it. We also asked how successful will California be in some of the specific goals that the Affordable Care Act has in it. Will we be successful or not? And in most of these things, Californians, large majorities, expect the state to be successful. And let me read those for you. Encouraging more low and moderate income residents who are currently uninsured to get coverage. 66% expect the state will be successful in meeting that objective. Obtaining the federal funds needed to fully implement the law. 64% think the state will be successful there. Establishing a one-stop place where it will be easy for consumers and small businesses to shop for health insurance online. 63% think the state will be successful in that. Providing consumers with more insurance choices, 61%. Regulating the insurance market so the average Californian has better consumer protections, 60%. So all of those very broad optimism that the state will be successful in its objectives. However, on one of the items, limiting the rate increases that insurance companies charge to their customers each year, voters are divided. And if you look to the right, you can see why they're divided. Democrats are optimistic, 62 to 34%, not as optimistic as they are on the other items. And Republicans are very pessimistic that rates will be held in check. Republicans greater than 2-to-1 do not think that's likely to happen. Okay, what extent, what awareness the level of voter awareness do they have about covered California itself? Again, prior to the outreach efforts that we're going to be seeing in the coming months. Just 25% of the public says they've heard a lot or have heard some
about covered California. That's a relatively low figure. 33% say they've heard only a little, so they probably heard the name, but they don't know much about it. And 42% have heard nothing at all about it. When you look at the proportion of people who say they've heard a lot or some, so this is kind of the more informed segment of the voting population, who are they? Well, unfortunately, some of the key target audiences are the least likely to be aware of covered California, at least at the starting point. Uninsured residents, 18% report that they have heard some or a lot of covered California. People at the lower income ranges, those under 139% of federal poverty, or even those up to 400% of the federal poverty level, just 22% say they've heard of covered California. The young, the invincibles, who we're trying to ensure are less likely to have heard a lot or some about covered California. And if we look at it across different ethnic populations, African Americans are less likely to say that they've heard a lot or some, and those who we interviewed in non-English languages were less likely than those interviewed in English to say they had heard a lot or some about covered California. All right, then what the survey then attempted to do was to identify a segment of the voting population who was actually eligible for the expanded Medi-Cal program. These are people under the age of 65, under 139% of the federal poverty level, which is about $15,000 for an individual, and who are not currently enrolled in any in Medi-Cal, or don't have any other kind of insurance. So they're either uninsured, or some of them are actually in the individual market. We asked them, are they aware that they are eligible for free health coverage under the expanded Medi-Cal part of the Affordable Care Act? Just 48% of this group said they were aware of that. 25% actually said, no, I'm not aware, or I'm not eligible. So you have some convincing to do there, and 27% said they didn't know. We also asked a second segment of the voting population. This was the more moderate income segment, people whose income is between 139% of federal poverty and less than 400% of federal poverty, which I believe is up to about $55,000, something along that line for an individual. Maybe it's 45, but we had an income threshold to define those who were making less than 400% of federal poverty based on their household size and their household income. And when we asked them, were they aware that they were eligible to receive tax credits when applying for insurance that covered California, just 33% said that they knew that they were eligible. So there's a big job to do in communicating, especially to the moderate income population, that they're going to benefit from this law by getting reductions in the cost of their insurance when they go to covered California and applying for health insurance. And again, these are people who are not currently covered by their employer or by a government program or labor union. Okay, what was voter interest? This is a more general question among all voters under the age of 65 in learning more about covered California and the kinds of health insurance and plans and options that are offered there. Interest is fortunately quite high. Even though awareness is low, there's two-thirds of the voting public says they're somewhat interested in learning more about this, and 34% say they're not. And who are the most interested? Here's the good news. The most interested in learning more are the segments of the voting population that covered California is intending to outreach to. So they're interested, they're waiting to get these messages. I think that's a good thing. The uninsured, 83% say they're interested in learning more about covered California. Those with incomes of under 139% of federal poverty, also more likely, 76%. However, the young segment are going to be a tough one to reach. At least they're not expressing the same level of interest as some of the other target audiences. If you look at the results by race or ethnicity, also some encouraging numbers here. Latinos and African Americans are much more likely to say they're very or somewhat interested in learning more about covered California, as are those who are non-English speakers. So there's going to be a receptive audience to the messages. Okay, and if you look at the results, and this is an interesting result, at least from my perspective, one of the complicating factors, I think, that will hinder, potentially hinder, the outreach effort are voters' predispositions toward the Affordable Care Act as they just look at the law themselves. If you look at the level of interest, it's actually correlated in some ways with their partisanship and their political ideology. People who are Republicans or conservatives are less likely to say they're interested in receiving these messages. People who are Democrats and liberals are more likely to say they're interested. So if you're trying to communicate to certain segments of the public that are eligible for coverage, this could complicate your outreach, especially if they're more conservative in their political orientation, because they're not as initially interested in receiving the information. Okay, then we also asked that population that we had identified who is eligible for expanded Medi-Cal. After we informed them that, hey, look, you are eligible for free health insurance coverage under the expanded Medi-Cal program. How likely would it be that you will apply for coverage next year? 74% say they're very or somewhat likely, which is a pretty good number, but it's interesting that 22% say they're not likely. And when you look at the 22% who say they're not likely, their level of awareness of the law is extremely low. These are people who just are not clued in, and they need more information to overcome any kind of resistance to the application process. We also asked the more moderate income Californians who were eligible for tax credits under the law, whether after we informed them that, hey, look, you're eligible for tax credits to reduce the cost of your health insurance, how likely is it that you will apply for these tax credits by going to Covered California and seeking out an insurance policy there? Slightly smaller proportions say they're likely to do so, 66%. 27% say they're not likely to do so. Again, a lot of this relates to the lack of knowledge about what this is all about, at least that's my judgment. When you talk to the people in non-English languages and ask them about Covered California, they would far prefer receiving information about Covered California in their own native languages. This includes both the Latinos and the Asian Americans. Okay, we also asked Californians, what about the burden that the law, the expansion of the insurance coverage will have on primary care physicians? Will California have enough primary care physicians to handle the additional patient load that's expected to occur? Most Californians say no. We won't have enough primary care physicians. 59% feel that way. 35% say the state will have enough. Much more likely to feel that way are Republicans, but they're also joined by nonpartisans. We also included a question about the idea of allowing nurse practitioners to expand the kinds of primary care services they provide. And you can see that that idea is supported quite broadly, 73%, and it actually gets support across party lines. The survey also attempted to measure how people were reacting to healthcare costs. This is something that is going to become increasingly important as we go through the whole process of implementing the Affordable Care Act. What impact will people see on their healthcare costs will be pivotal in the years ahead. Here's a baseline measure before any of this kicks in. 50% said last year my healthcare costs went up. 41% said they stayed about the same. This is pretty much what the national polls were also showing if you look at the Kaiser polls. We asked voters their difficulty in paying for health care. How difficult is it for you to afford to pay health care? Again, 50% are admitting that this is difficult for them to do. 21% say very difficult. 29% say somewhat difficult. And if you look at, well, who are these people? It's the populations that you would expect. The uninsured, 72% say that they're having a difficulty in paying for their health care costs. Then if you look down the list, people insured through the individual market, 60%. Those who are insured through Medi-Cal, 63%. and it's definitely related to household income. The lower income you are, the more difficulty you would have. But I guess the good news here is that these are the very populations that the Affordable Care Act was intended to help. So as we poll next year, hopefully the difficulties in affording health care will start to subside a bit among these target populations, since they should benefit more from the law. I think that's it. I'll be very happy to answer your questions once we get to the panel discussion.